Welcome to the Aesthetics Unfiltered podcast. We are Michelle Jones and Melanie Torres, two leading medical aesthetic nurse practitioners and great friends based in California. We uncover the inner workings of the booming aesthetics industry from both the patients as well as the providers' perspectives.
Join us for the authentic conversations about current and trending treatments, best practices, and the real issues people face with modern beauty standards. Any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
Hey everyone, welcome to episode 5. I'm Michelle Jones. I'm your host today, and we have Melanie Torres, your co-host. We are both aesthetic nurse practitioners, and today we are talking about filler myths and truths and just busting some things that we hear out there. So it should be a nice educational and fun episode. How are you doing today, Mel?
I'm great. How are you doing, Michelle? How is everything going with Whiskers, your beautiful cat who is just my FaceTime lover?
It's been a challenging week. I'm not going to lie. I'm better than I was at our last episode recording. You know, she's probably not going to make it this week, to be honest with you, but I've said bye so many times, and we've had like 5 vet appointments, and it's really hard. Honestly, she's my child. And, I never take time off for myself. Like, I'm a workaholic, as you know. But this week I actually took off 2 days and just like sat with her and listened to depressing emo music and pet her, because that's where I'm at. And it was really cathartic. So
you're just spending
she's
time.
A rescue, as you know. And she's a Persian Munchkin cat. So she's like a grumpy faced cat with short legs. And like, I just instantly connected with her. And she has the same birthday as my husband, which is kind of silly. Like, they're very in sync. But she's comfortable and she's hanging in there. She's only eating treats right now. She basically has liver failure, and we had a pound of fluid drained out of her belly this week. It's like a whole thing. Like, I could have a cat like TikTok, YouTube on this. So it's been challenging, but I'm at peace right now, and I know we've given her a really good life. So send your wishes and prayers to Whisker.
I'm sending my love to her, and I know I let you know, I think you should feed her shredded roasted chicken from Whole Foods. Has she been able to eat anything?
She's only eating these treats called Churi, which thank God somebody messaged me on my DM and like told me about it, because I couldn't get her to eat anything, but they're a life send. So she's eating like 3 of those lickable treats every day, and I'm like, thank God. But I've tried everything. I have like a whole supply of shredded chicken, like tuna cans, like I'm feeding her like liquid. It's a whole thing. If anyone's a vet out there, reach out to me, okay?
Yeah, for sure. Okay.
Or like, I even got a psychic cat whisperer. That's how psycho I am. And like, I mean, I've already signed up for like a whole sleeve of Whisker cat tattoos on my arm, because I just turned 40 and my hormones are crazy. So, you know, that's where I'm at. Sorry for the detour, everyone, but I know Whisker's a big topic.
Yeah.
She has a big fan club on my Instagram. I have like 70 DMs about how Whisker's doing. So she's very loved.
I love her too.
How was your week, Melanie? I went off on a tangent. I want to know about you.
It's been okay. It's been good. Just hanging in there as well. You know, it's a little slow at work right now. I think everyone's on vacation. It's wrapping up. People are going to start going back to school and work soon. But, I'm just chilling as well. I've been reading a lot, hanging out by my pool. I read this really interesting study this week that I've been thinking about and talking about. It's about having kids in America, and how everyone's just having less kids. It's a Pew Research study that came out, and now people under the age of 50 saying that they're going to have kids is only about 70. I'm sorry, my bad. People that are under 50 in America, only 50% of people are now saying they want kids, and that's gone. So in 2018, about 37% of people say they never wanted kids under 50, and now it's up to 50%. So America's it's crazy, and the average, it's the lowest birth rate in America as ever in the entire history of the world. People are only having 1.5 kids on average for a family. And then you always hear Elon Musk being like, you have to have more kids. I have 12 kids. But like, it's really hard to have kids. And now younger people are realizing it's hard to work. It's hard to be successful in your career, and also just hard to pay for childcare. So it was a really interesting study. If anyone wants to learn about it, it's a Pew Research company. It's a research article called "The Experiences of U.S. Adults Who Don't Have Children." If anyone wants to read.
I mean, I read an article. It's even hard to have a pet right now. Sorry, back to the pets. I'm like, honestly, like, pet, unless you have pet insurance, like, it's so expensive. Just if we didn't have pet insurance with all of Whisker's like vet bills, it would be insane. Like, it's sad though, like, just how expensive just having a pet is. And I don't know, of course I was on TikTok scrolling, and it was like, they said it's becoming like an emergency how many dogs and like pets don't have owners, and like they can't even house all of the pets in the shelters now. It's so sad.
It's so sad. It's because everyone got a pet during COVID. They got cats, and then they just ditched them in shelters because now they're back to work. It is so mean, and I think people need to like really think about what a big responsibility a pet is. If you're like working like away from home for 12 hours a day, it's kind of mean to just keep a pet like in a super small apartment. Like, I know your husband and you have a flexible schedule, but I don't know, people I don't think about the responsibilities, similar to kids as well. Like, you really have to see like what's best for the person or animal too that you're bringing into your family.
Well, I feel bad because we got her during COVID, and we were both home, but I work a lot, as you know, and so I'm not really home. And then my husband is working. They're making, the back to work is picking up a little bit more to have presence in the office. And so that's why I even talked to the cat psychic. I'm like, does she want another cat? And the lady was like, absolutely not. She does not want another cat in there.
Yeah, I mean, I think cats they like to be independent, and like Whiskers always seems happy, and you like, Graham and you, like, you have flexible schedules, but dogs, if there's like a lone huge dog in an apartment by themselves, I don't have pets. I wish I am a crazy cat lady. I'm a pet. I love pets, but I live by myself, and like, I just feel too bad having kids or pets.
I know. I'll lift up Whisker for the camera at the very end, so we can have a shot of her in there.
Do it,
because it might be, hate to say it, one of the last ones. So
well, I love Whiskers. I want to see her before we get off. I won't
start crying today. I've already got it out. So full face makeup. All right, let's get into aesthetics.
Okay.
So what we're going to talk about today is just things that we hear in the clinic pretty frequently. Filler is a hyaluronic acid based gel that we inject into the face to plump up the face, but it's very artistic. And, I think there's a lot of negative chatter online about filler, especially recently, the last year or two. People are just so confused. And we just want to clear up some of those myths that we hear all the time. So basically, filler's been around since the early 2000s. And really, the portfolio filler has evolved, where back in the day, we only had like one or two products, and we just use those all over because that's all we had. And now it's really sophisticated, where it's like a color palette, where like each filler has a specific purpose, and it can be meant to like project, it can be meant to just help hydrate, it can be just for skin texture improvement. So there's so many more uses of filler now, and actually the training of filler has gotten a lot more sophisticated just because there's so many new products. And we can the outcome of that is people are looking, in my opinion, you can make people look really, really natural. I think it's easy to make someone look done. It's actually really hard to have a good aesthetic eye and maintain someone looking naturally. And that's where the art of filler comes in. And we're going to just dispel some common things we hear in the room. What's your take on all of that, Mel?
I think there's a lot of chatter online, on social media, on all of these websites. You know, I think that there are these myths and truths that there's some truths, but a lot of the myths are blown out of proportion.
Yes.
And it's fear-based. Like, all media is now to get your attention. People focus on the negative. And I think that the best place for you guys out there that I want to learn about fillers and Botox is always not to. I remember, like, in grad school, people would say, do not believe anything you hear online. It has to be from a credible source. So if you get information that is confusing to you, the best place to look it up is like evidence-based research, where you can type in research article on Botox, research article on filler, and, you know, go to studies that are done in like scientific evidence-based research articles like JAMA, Journal of American Medicine Association. I think that's what JAMA is. And anyway, they have these research magazines that put out information that is truthful. Don't just listen to a TikTok, you know, girl who's not even a nurse or a doctor or medical assistant. She's just telling her information, and like, you have no idea if this is true. So that's my take on it. So today we're going to talk about some myths that we know about, that we've had experience with dealing with in the clinics. And I don't know, Michelle, what are your top 3 myths? We're each gonna do 3 myths that we hear a lot about.
Yeah, I think, I mean, there's a lot of different myths out there. I think I'm gonna cover filler will stretch my skin. Anyone can inject filler. Fillers will make me look fake. So those will be my,
cool.
My 3 ones.
I can't wait to hear all your little info on these 3 myths.
Yeah. I mean, back to like, I love what you said about media and negative media. And even me, I've been spicier online. I mean, I don't mean to, but I think I'm just following the trend where I'm like, damn, did I really just say that? I'm getting intense on there. I mean, it's all like my truths, but like, you know, I'm just kind of reacting to what I see out there and following the trend. But I'm hoping that this podcast can be like a place of like unraveling some of those truths. And we want to really be science-based for you guys, but also fun, and have an honest discussion about it. But yes, I've been injecting for 12 years. I'm a national trainer for 2 different brands. I mean, I've been doing what I did with filler back in the day is totally different than what I do with filler now, because my tools have changed, my aesthetic has changed, the trends have changed. So we got to mold. But the first one is filler will stretch my skin. Now, this is just, I hear this a lot, and not so much lately, but like, I think a year ago, it used to come up a lot. Filler is like the size of a blueberry, right? So like, it's a really tiny amount. I think this could be more truthful if like you were over blowing up your lips and then you dissolved it all. And then you might feel like, oh, my lips are not as tight as they used to be, potentially. But for the amount of filler to stretch your skin is an insane amount. It's not like a little drop on the cheeks and like a little drop in the lower face and a jawline. And that's how I treat people. So these are people that are maybe more in the extreme. I don't think I've seen any research article on filler stretching the skin. I guess I should research that. And if anybody has, you know, anything like that, but that would be an insane amount, just because really, like 5 syringes of filler is like 1 teaspoon. And I kind of want to backtrack on that, because I do want to kind of do an Instagram post or a TikTok about that. And I'm going to kind of contradict myself right now, but like, yes, filler is the size of 1, like blueberry, 1 ml.
You mean one syringe? One syringe is the size of a blueberry.
Yeah, okay. 1 syringe. Yeah, but it pulls in water, right? So it pulls in like something like 1,000 of its water weight. It pulls in a lot. So I think that's not really true when we see that out there, and I'm going to talk about that too. But anyhow, it's a small amount in there, and even if it pulls a lot of water, that would be a lot of fillers. I think that's a little extreme. And again, these are people that are watching these TikToks or Instagrams, and again, everything's fear-based, and they want to see things that are extreme, and then they bring it up, and it's tiring in the room to dispel these myths. I've never had that. I've never seen anything like that, unless I've even dissolved some really crazy lip filler. Like, people have like 5 syringes in their lips, and like, yes, when you initially take all that out, you might feel like it's a little bit looser. but your body replenishes that hyaluronic acid and kind of, fills it in. It hasn't been a problem what I've seen.
Yeah.
So I think that would be like botch level in my opinion. What do you think, Mel?
Yeah, I've never seen skin stretch. And I mean, people, even when you get filler, we do all age. I was actually just looking at myself recently, like I'm 48 years old, and I took some selfies like yesterday in my office, and I noticed I'm starting to get like lower face laxity. I mean, I'm almost 50 years old. And, so even if you don't get filler, your skin will start looking a little stretched because we lose collagen, we lose, fat, we lose muscle. So everyone looks a little stretched if you don't get it actually has to just do with generalized aging. So I get filler, but I'm still aging. We all age. It's just that I think we can age a little more gracefully with our treatments. And also I was like, well, I have like jowling now a little bit, but Michelle, I'm coming to visit you and you're going to be doing like a Sculptra, like help on me. But we're always really hard on ourselves. So I think people are like, our skin is stretched, but no, I've never seen anyone, and I don't really dissolve filler that much because it naturally biodegrades. It naturally goes away. There's always maybe a little residual, like that's a whole thing on TikTok, but for the most part, your body naturally breaks it down. So it's not in your face for long periods of time. And so
Well, I'm going to talk about that a little.
Yeah, go back.
I think
go ahead.
I think it depends on your metabolism and how long you've had the filler. There was a study on an MRI that filler under the periorbital region, like the tear trough, lasted up to, I think, 12 or 14 years. So I guess it depends on the amount of filler. So there's a lot of like controversy over that right now.
But that's only a little bit that retains.
I don't
it's not,
know.
You think the entire syringe lasts under your eye for like your whole life?
I don't know about that. I don't think it's the entire syringe. That's kind of crazy because it breaks down. But I think that's something we don't know unless we measure it with an MRI and have more studies. But I don't know. I think it depends on the person. I see like in my like really athletic patients, or if you have a high metabolism, hyperthyroid, or you're on Ozempic and you're losing weight, those people are going to metabolize their filler a lot faster than somebody who's not actively working out. That's my, again, I haven't seen a science-based article on that, but I think we used to think that the fillers would break down mostly, and I think that is true for a lot of people, but now with that latest MRI study,
I think they last longer than people say they do, because
we last longer.
Pharmaceutical companies will say, oh, it lasts for a year. Some fillers can last up to 2 years, but they say most of them break down between 9 and 12 months. But I don't agree with that. And I think that's a way of pharmaceutical companies selling syringes and trying to make more money. And it depends on the metabolism. It's like my filler in my lips, like I get it once every 2 years, like a half a syringe. And I feel like my lips are still bigger now than they were before I ever got filler. So I think definitely, unless you're, like you said, a runner or some people just break it down super quick, but the average person, I believe filler lasts longer than what they say on the labels.
Absolutely. Yeah. I think that was the biggest, thing the last 2 years is I think my patients 3-4 years ago, we did a lot of filler. We did a full facial correction. I really, when I see them, I just do little tiny touch-ups. They don't need much anymore. The people that have really corrected the full face, and it's lasted. And it's been at least 2-3 years with those patients. And I'm like, dang, let's just do skin stuff. Let's do other modalities just to work on your skin health because your volume is good.
Yeah.
And I think that's what injectors need to adapt to, with the trends. But we're getting off topic. But
no, but I think this is one of the biggest myths is that filler only lasts a certain amount of time. And I'm glad we chatted about that.
Yeah, I think it's it's variable, and really we don't have an MRI machine that we could just scan you, but ultrasound's getting more popular, and we could ultrasound you and really see. It doesn't tell us, I don't think ultrasound tells you how much is in there, but you can really see if it's a good amount. It would be like a big black glob if it's hyaluronic acid filler. And I did my whole face. I can definitely see some in my cheeks, and we can go into all of that.
Super cool.
But
I think people get super cheeky when they do their cheeks too often. And so we have other info on that in our other podcast about ways you can prevent that, and doing Sculptra that is super popular now. But yeah, anyway, what's another myth, Michelle, or another truth?
Yeah, I mean, I think another myth is, anyone can inject filler. And that is, okay, that's true. But why have I spent 12 years perfecting filler? It's like when someone's taken one course, like the person who's taken one course and their filler is like half the price versus somebody who, I'm going to say the word specialist, like the Olympian. I was watching the pommel horse specialist guy. Sorry, off topic.
No, off topic if you guys, good. No, Michelle, off topic is good.
I was watching the Olympics with the male gymnastics, and I was really into the specialist guy who was sleeping the whole Olympics. Then he pops up and he's ready and he like nails it. That's how I think of like, us that are filler specialists.
Right. I always read in all these magazines, only go to a board certified dermatologist or board certified plastic surgeon for these treatments. And they talk about like diamond glow and like Botox. And I'm sorry, but nurses and PAs and NPs, our scope of practice is to administer medications. That is what our main duties are, as well as diagnosing medical problems, assessing the patient. So we are allowed to inject Botox, we are allowed to inject filler, and if you're properly trained and have a great aesthetic eye, you do not need to be a dermatologist or a plastic surgeon to inject these medications, but you need to be a licensed medical professional. You cannot do it yourself. So what are your thoughts on this? Is anyone can inject filler?
Okay, so yeah, we'll clear it up. I love what you said on that. This is a big topic too. Yes, in the state of California, every state is different. We have to be a registered nurse practitioner, physician assistant, or medical doctor to actually administer any cosmetic injectables. So Melanie and I are board certified nurse practitioners. So yes, you definitely need to follow the state laws. Let's be honest. That's crazy. And there's a lot of chaos in our industry. There's a lot of like things online that people think, going to a doctor or a dermatologist is safer or better. And honestly, I train a lot of them. That's what I do. I'm an aesthetic nurse trainer. And so I train for a lot of these. And I would say it just depends on the individual. There's a lot of, doesn't matter, it's hard to say like, go to this person, but, if the majority of your practice is injecting, you're probably going to be pretty good. If the majority of your practice is dermatology, like clinical, medical, then you're probably not doing, as much aesthetics. And, for me, it's kind of like, this is such a niche specialty art that you got to be doing it full time or majority full time to be an expert, in my opinion. And so if you're doing surgery 90% of the time and you do aesthetics one day, just because your title might be XYZ, I think the public can kind of gather who's the specialist. Back to the specialist.
100%. I think I totally agree.
Who's attending the trainings? You got to be attending trainings. You got to be evolving. You got to, be doing it at least 70% of the time. And that's what I would look for in a practitioner.
Experience for sure. And asking questions before you get it done. Like my thing with only doctors, derms, and plastic surgeons can do this is so many times when I worked in the hospital, nurses actually can save lives. And there's some orders I've gotten from doctors before where we read those orders, and I've seen nurses save people's lives because there may have been an order or a patient changes status and they want you to give a medication. And there's something called nursing judgment, is when you see an order from a doctor and say the patient's changed and they shouldn't take this medication anymore, or they're an emergency, we have the right to not do the doctor's order because it's not safe for them anymore. So anyway, what I'm saying is nurses and mid-levels, we have like, sometimes we may know more than a doctor who isn't around that much. So I just think that there's this myth that only doctors can do our job. And I've seen nurses, these amazing charge nurses that have been a nurse for 40 years, like in aesthetics and in the hospital, that honestly have more experience and better understanding than some doctors do.
Yeah. Oh, yeah. I think it just depends on the experience and what that practitioner is doing every day and how much energy they put into it. And do they have a good aesthetic eye? Because that, we talked about this last time, you can't really teach that. And everybody has a different aesthetic, and my aesthetic might not reach everyone's aesthetic. I'm like very conservative, natural, artistic, preventative, but that might not be the aesthetic in different parts of the country. But it works for my clientele. So it's like, but yeah, and I think, I love what you said about, it doesn't always matter your title. I mean, you want to be like a medical professional who's licensed.
Yes.
But it doesn't, going to see a plastic surgeon doesn't mean you're going to get a better result with injectables.
100%.
That's what we're trying to say.
Yep.
Anyhow, my last little myth is fillers will make me look fake. And so this is like such a big topic, or fillers will make me look unnatural. And we hear this so many times, and yes, it's actually really easy to make someone look fake and unnatural with filler, but that's where the artistic eye comes into. And if you go to a practitioner who has you mesh with their aesthetic, review their portfolio. I pride myself on making my patients look natural. That's like what I pride myself on. So, and everyone's idea of natural and fake is different too. So it's hard to just make that a blanket term, because my idea of natural might be totally different if somebody else is natural, right? So we really have to have these conversations, and you really just have to find a practitioner that you align on the same aesthetic. But I think the evolution of fillers and the different types of fillers, we have so many more tools in our toolbox of different types of fillers that kind of are stretchy, go with animation, integrate into the skin better. The techniques have evolved. That's why we have so many trainings. I think the whole point of the filler evolution is to make people look natural. So I would say that is a myth, unless, you're going to someone and their work online, it looks a certain way. Gravitate to work towards what you think is natural and really have that conversation. So I do think filler can look extremely natural. I mean, I've been doing fillers, and you've been doing fillers since I was 32, probably. I'm 40.
I've been doing them for 7 years, and you've been doing them for what, like 10 years, 12 years?
Yeah, there's a photo of you injecting me where I looked like I was on my deathbed and then I came back to life. I kind of want to repost that one today. It's like, thank God. God, I looked like I was going to die.
Oh, the jawline, when we did your jawline. And we did your tear troughs and jawline. I remember that.
I was in middle of nurse practitioner school. I was like exhausted, run down, working 50 hours a week. It's like, I literally look like I was, somebody asked me if I had cancer and I started crying. Jesus, people are mean.
I'm sorry.
That's what I knew. I needed you to inject my face. I was like, get in here, Melanie, and do something. I don't even care.
Well, I'm excited you're going to be doing that to me like next month when I come visit you.
You look perfect.
Thank you. Well, cameras help.
Yeah, so those are my 3 myths, I think it's a conversation. I think we see online a lot of like celebrities who had overfilled faces, and then they dissolve everything and everyone's like, oh, they look so much better. And then like that gets in everyone's head that filler looks unnatural, when people who are posting that just want attention and likes, and it makes me pissed. I'm pissed about that.
Me too.
So anyhow, moving on.
Okay, so this is one of my myths. This is a good myth to go into that we were just talking about. It segues into mine, is that filler is permanent and that you're stuck with. So say you go to a crappy person and get an outcome you don't like. So the people get scared you're going to look bad forever, and that you just are going to look crazy. And so that's a myth. So filler is dissolvable, except, all HA hyaluronic acids are dissolvable with a medication called Hyaluronic. It's also called hyaluronidase, and it's a medication. So say you get a bump, or say someone wasn't a great professional and you got your lips that are like super overdone and huge and you just hate them.
You solved my lips. Remember when I was super botched?
I did.
Never
So
be like a model for someone.
Yep.
Honestly.
So I
can't
use
do it.
Hyaluronic, an injectable, and we can post this video too on our podcast site. And so I injected the medication, and it takes 24 hours for it to completely work because it slowly breaks down the Hyaluronic breaks down the filler. You can get it done in your lips. You can do it anywhere where you get hyaluronic acid filler injected. It can be dissolved with Hyaluronic. And then there's also this myth, oh, well, it's also going to dissolve all of the hyaluronic acid around my filler. And I've honestly never seen that, Michelle. And you do Hyaluronic in very small little increments. You might have to come in to get it dissolved a couple of times because a good practitioner won't over dissolve it.
Well, let's talk about that. There's a lot to unravel in this whole conversation.
Hyaluronic acid is dissolvable and can be taken away with Hyaluronic.
Yeah, so I love that. Yes, it's reversible, exactly what you said. There is I think what we're finding though is people who've had maybe 10 years worth of filler, it's not as easy to dissolve as we thought it would be. So that's more of an extreme case. And that's why we have ultrasound to really target and dissolve things more strategically in those type of patients that might be really, really overfilled. And that's kind of a new thing that has been evolving that we're, other injectors are kind of hey, it's not as super easy to dissolve as we thought. But if it's a lip, I really haven't had much problem dissolving lips unless it's in the mucosa of the lip. I found it's a lot harder. Have you ever had bumps? Have you ever seen that, Melanie? People
what
with,
inside when they comes in into your inner mouth? I had one patient that had a little bump on the inside, either migrated over into the mucosa. It worked for me, but it was tiny.
Okay.
I haven't had a lot of dissolving even having to do. I haven't had any of my patients come in and be dissolve my whole face. When I've dissolved before, I have only had a few people that I've completely dissolved their lips because it's migrated. And usually when that happens is I think I talked about this before, is they go to a different practitioner. I didn't inject their lips, but they'll come to me and be I don't like them. And so I've done that a couple of times, but I've never completely had to dissolve any of my patients' lips. I've had a few bumps on people's lips that I've dissolved before. And then sometimes one woman came in and was my cheek, they're very particular. My cheek, there's just a little bit too much here, so I did a little dissolve there. I just did a man's jowl, and he thought it was filler, but it was actually just his jowl was so big. He's oh, is that filler? And I did a little bleb of Hyaluronic, and it was actually his jowl. It didn't do anything to it. So usually Hyaluronic is only needed for little bumps and whatnot.
Yeah, so I had... Yes, I believe that, but I think there's a lot more to unravel a little bit in the sense that just people are saying online, I think some of the injectors that are really good with ultrasound people are actually flying to see them for really overdone botched things, and that can take a ton of dissolving.
What do you mean by just someone that's been getting filler for 20 years and doesn't like it anymore?
Okay. Yeah, or they looked done and they hate the look now, or their injector was hey, no more filler, or they look unnatural, right? So I think I really haven't had many of those in my clinic either. I'm lucky. I mean, I've had the conversation with a few people, but that's a whole psychology thing before we dissolve things. But sometimes it can take a lot more dissolving than we think. I think, there are practitioners who are over dissolving the lips in one session, and that's a whole nother topic where I don't believe in that. I think you need to do one vial max at a time, and I might get some hate from this, but having someone's lips blow up ridiculous amount of swelling is actually not good for the lip either. I get it if they're flying in from somewhere else and you need to get it done, but I don't believe in that extreme of a reaction. I usually don't do more than one vial of Hyaluronic in the lip at a time if they have a lot of filler, because it's already going to swell a lot, and then I see them in a week or two and keep going. I think bumps in the mucosa are hard to get rid of. There is just a harder area to dissolve, and it might not completely go away. In my opinion, it's really hard. If it's in the actual wet in the regular body of the lip, it's a little bit easier. But yes, in majority, I think the whole topic of this is like filler is reversible, and that's why we have Hyaluronic or hyaluronidase.
And 90% of the people don't ever get anything dissolved. It naturally biodegrades, and for the most part, one's body breaks it down and you don't have to get it dissolved, except if it's physical, unless you don't like the outcome. There's a bump that you don't like and is visible. It's normal sometimes to feel filler in your skin, because that, especially when it's integrating. But so just know that it is not a permanent thing. HA filler, it can be dissolved if you need to or want to.
Yeah, and I had an occlusion in my temple once, so I had like maybe 5-10 vials of Hyaluronic. It was terrifying.
Wow.
And so I've had a lot of dissolver at times. You've dissolved my lips. We did a whole vial. I've had no laxity issues with that. I know that's a thing that people talk about. I've never seen it. I've had so many. I dissolved my whole jawline one day because it was about, so I've probably dissolved everything on my face at least once or twice. Yeah. And I feel like my skin's pretty damn tight. I think, we replenish our hyaluronic acid naturally every 24 hours. So you might see when you're dissolving a lot, actually, you won't even usually see that, but theoretically, your body replenishes that within 24 hours of dissolving it. So, and I think the half-life of Hyaluronic is something like a few minutes. It's something really fast, so you might see it dissolve like pretty quickly. But because of the swelling, it's you might not see a big improvement until like 24 hours, like what you said, Mel. And then I usually see it even like slowly dissolves over 2 weeks, and I don't know why, but that's like my theory. It's like 90% within like a few days, and then I see like another 10% up leading up to 2 weeks. So I like to give it like a week or two between doing repetitive dissolving for people.
Okay, that's good.
That's just kind of like what I've evolved over time. But yes, exactly what you said. Filler it doesn't have to be permanent. Everyone breaks it down differently. And I like what you said. That's why we have that enzyme. And some practices don't even have the enzyme. I mean, Jesus Christ, that's terrifying. You should have it for an emergency if it gets in a blood vessel. So I really don't train people unless they have at least 10 vials on hand of dissolver.
That's like standard protocol in case, God forbid, which is a very, just if someone gets an occlusion, which is a very rare thing also that happens. I think people, people are like, oh my God, I have an occlusion and this is an occlusion. But again, just go to that's a very rare happening. The blindness, it has happened in history, but for the most part, 99.9% of the time, there is no visual issue. I just think there's a lot of fear online that people don't really study about. And then also my next myth, truth debunked is you can go with the cheapest price of filler is the same as going to something that's overpriced and $3,000 a syringe. It's, price doesn't matter with filler. Like you can get it anywhere and it'll all be the same outcome. And I feel like there is a lot of scary stuff going on in the market and the industry because it's such a widespread industry now, and like you can get different people are ordering fillers online from other countries. Some people are like, I had a patient once come in, I was on call, a weekend call, and she came in and she's like, hi, I injected my own filler at my house into my tear troughs. And she bought it online from Asia. Jeez, and she came in terrifying. And she had like a big bump under her eye. And she's like, will you dissolve this for me? And it was actually just swelling. It's just scary. I think that price in a way kind of does matter. It's like, I wouldn't go to a place that like you can get a syringe of filler for like $200 because they cost more than that at like the brand names. You're not
making any money. What are they doing?
Right. And it's like,
what?
Again, it's like just do your research and just if you have a budget, save up for somewhere that is reputable and that has many reviews online that you can like go in for a consult first. It's cheapest, doesn't make better. And then also sometimes a plastic surgeon or doctor can charge $3,000 for a syringe of filler because they have the reputation. But, on average, costs of filler in the market, I think, depending on the type, are like from like $700 to $1,200 a syringe,
Yeah.
$500 to $1,200 depending what part of the country it is. I don't know. I just think that cost is like an issue for a lot of
Yeah.
people.
Yeah. I mean, yeah. If I see, this is just how my brain works. If I see something that's like super cheap that I think should be high end, it's a red flag for me. And yes, I know price is an issue, but there's a lot of crazy things that can happen with filler. The number one being you can blind someone. Number two, it could be fake, and like who knows what you're putting into your face and how years down the road it could react. Like you should only be getting your fillers from like the actual pharmaceutical company that sells the filler. And it's hard because patients can't really discern this because people are getting sneaky, like I don't even know, like fake companies and making the boxes look very similar
So shady.
to the,
So
and it's
shady.
so shady, and it's terrifying. I
Yeah.
mean, luckily I work for a big, great company that it's very safe, and like I feel like it's like the safest place to work, and I'm grateful.
Yeah, if you're ever
but
going
I've
to a
heard
place,
stories.
yeah, if you ever go to a place where you're like having a red flag or feeling like you always go your instinct, you can always ask, even though you said like sometimes it's in a fake box, to see
Take a photo.
the filler that they're putting into your face. He'd be like, hey, like,
Yeah.
and it doesn't, you know, this is, you don't have to do it everywhere, but if you're go with your gut instinct, be
Yeah.
like, hey, what type of filler are you putting in me today,
Yeah.
and what brand, and you can look at it, and
Yeah.
that's one step to be a little safer. But again, it's doing your research
Yeah.
before you go and getting a treatment.
I mean, I think people should know what filler is in my face. Like number one, like that's it. I always tell my patients, here's the filler we're using. This is its indication. This is the longevity. I like to show them the box with the expiration. I'm nuts. Like that's what I would want as a patient. You need to do that now, people. You need to know what's in your face. At least write it down and keep a record. I
That's
mean,
smart.
it's helpful if you go somewhere else. This is to the patients out there. Because if you're jumping around to injector, I want to know what's in your face. And if you can keep a log, it really helps me.
That is so smart. So smart.
Yeah. I mean, it's just like if I was a patient, I would keep a log of what the hell's in my face. I'm sorry.
That's super smart. I agree with that.
All right, next one.
And then the last one, this myth and truth, is when you get hyaluronic acid filler, it's super painful. So I'll tell you my experience getting it and giving it. Sometimes it can be spicy, especially in the lips.
that word.
Even if you get, most people numb with topical numbing cream. Some people inject numbing lidocaine to make it not hurt. But sometimes even if you use topical numbing cream, especially in the lips, it can be slightly spicy. But it can hurt. But sometimes it doesn't, depending on how gentle the injector is. And it's normal to be a little bit sore for a couple of days afterwards. Don't think that that's not normal. It can, because there's swelling and there's been trauma to the areas. So being a little sore for up to like a week, it can be, that can happen sometimes. And sometimes it doesn't hurt at all. I've had magic people, doctors, nurses that like have the lightest touch where it like doesn't hurt at all. And I'm like, that's a lucky day. But sometimes it can be painful. Cannulas, I think, to me, help not being painful is when you use a cannula. I don't use cannula in the lip. I just get scared of that.
Cannula on the lip freaking hurts,
Yeah,
man.
to
It's
me,
like
I
the
would
worst
never,
pain.
I don't do cannula in the lips, but I find that
go into that
cannula
later.
actually helps doing in the cheeks and whatnot. It's less painful because there's only a couple of pokes versus many, many pokes. And if you're experienced with cannula, I think that can help with pain a lot. But being sore and swollen afterwards, up to a week, up to 2 weeks with filler, it can take 2
sometimes.
weeks for it to really settle, and icing really helps with the pain. Always get the person's contact information, their email, text, the number of the clinic that you get it. You can always ask questions afterwards if you're worried about pain. Usually it's important if you ever to get filler, especially the first time, is to make a follow-up appointment after you're done that day, so you can come back and have the provider assess you and see how the results are, look at your before and after pictures. Just always have the contact information if you have any sort of fear about the pain afterwards.
I love that. Yeah, I think I agree with you on all of that. I think pain is so subjective, and patient to patient is so different, how we manifest pain. And sometimes, pain is, we can't be in someone's body and see how their pain is. But if someone's wincing or really having a hard time, I usually stop. And it's never really happened. I mean, it's pretty rare for that to be someone to be in that much pain. I think we have so many tools. So pain is super subjective. I would say, it's kind of like my roadmap of following someone's face. If they're doing fine, and then all of a sudden it's like, ow, that's like an indicator of hey, might be near a blood vessel. Usually if we're near a nerve and a blood vessel run together. So it's kind of my indication of ooh, not a good spot. So I'm constantly in tune with the patient is energy in their face as I'm injecting. It's very normal to feel sore after, like you said, but everyone's pain versus soreness is different. If you're in severe pain, that's rare.
Contact your provider right away.
If you can't sleep, it's so painful, then contact your injector.
And if they don't get back to you, guys, this is our profession. If someone just bails on you and is bye and doesn't care or offer you a post-care appointment, that's really unprofessional. You should always be able to contact the office, the med spa, the provider via email, via text. I really am now trying to build relationships with my patients. So, and not everyone does this because patients can also be stalkers and annoying. It's I'll shoot them, no offense guys, but sometimes you can go a little bit overboard with the questioning. But I always shoot them a text 24 hours after, hey, hoping everything is going well with you. Let me know if you have any questions. You can do that via email or text, but if someone just bails and doesn't have an honest way of getting in touch with them, that is a huge red flag.
Yeah, I kind of consider myself a concierge service. My patients email me, they text me, they DM me. I turn off my phone 3 hours on each Sunday because I need mental health. Sorry, you guys.
Yeah.
But besides that, I'm always on there. But yeah, that makes not everyone can do that. I think we need balance, and I probably am a little too over the top, and people have told me that I need more balance in my life, but I love my patients. They're kind of like friends. But, if something's wrong, I can just put them, or if it's not wrong, I can put them at ease and read what's going on really quickly. And there's certain signs if there actually is something that doesn't add up and it could be a complication. So I like to be in touch with everyone, but there are some injectors that just ghost patients and Jesus, you definitely want to have somebody who has your back and is going to be there, especially in an emergency or even to help calm you down.
100%.
And that's super important. That's part of picking an expert injector, someone that can be there and help you. And half the time it's just me encouraging people. That's normal. That's 90% of the time. Mm-hmm. But we want to just look at things and be safe. But yeah, you'd be surprised how many injectors don't do that.
Oh, totally.
And that's not good care. So I agree. I think pain is different. There's so many things. The topical numbing, it should be on for at least 20 to 30 minutes or else it's probably not that helpful. There's different strengths of the topical numbing. You could ice them. I think ice is great. Just icing right before you poke someone is kind of sometimes better than any numbing.
100%.
I'm doing a little bit of I don't want to call it dental block, but infiltration in the oral mucosa. That's kind of numbs the whole lip area. And that's been really helpful, but sometimes it creates a little asymmetry on the lip before I inject, and that, so there's pros and cons to everything. But severe pain is not normal. Soreness is normal. But everyone's pain is subjective, so it's hard.
Totally. But always just reach out if you have any questions.
All right. Thanks for tuning in. We're going to wrap this one up. You can follow us on our socials at skin.smarty.np and melanie.skin.np and aesthetics.unfiltered.podcast and IG. We had a blast talking about the discussions of filler myths on this episode. There's a lot to unpack. We could probably even go on for another 2 hours. Honestly, I could. Thanks again, you guys. See you on our next episode where we will be unraveling both Botox or neurotoxin truths and myths. For our latest news, follow us on Instagram at aesthetics.unfiltered.podcast or in our personal pages on Instagram.
Mine is melanie.skin.np and Michelle's skin.smarty.np, both on Instagram. Have a great day.